My name is Dr. Pylawka. I practice sports medicine in shoulder and elbow. So most of the sports injuries I see are in the knee, the shoulder, and the hip. Most of the hip is the labral injuries, but I do shoulder replacements and knee replacements as well. So when I first meet a patient, it's very important to me to make them feel comfortable. Patient education about their ailments is very important. I also make sure that they understand full treatment modalities from non-operative to operative so that they have an understanding of the injury and how to treat it, and that they can make the decision whether they want to pursue the operative or non-operative route. So if the patient does need surgery, on the day of surgery, we often meet the family and the patient an hour or 2 hours before, make sure they have any questions about the surgeries that are answered, make sure the family, if they have any questions. Once we proceed to surgery and the patient's recovering, we talk to the patient post-operatively as well. You know, I think the scariest part is the anxiety of the surgery. Not understanding step by step what's going to happen. I mean, it's one thing to meet us in a clinic and understand that I'm the surgeon, I'm going to fix what I need to fix, but the entire aspect of it, from the pre-anesthesia appointment, anesthesia, post-operative pain control, I think it's very overwhelming for patients to get the whole picture. So, you know, my mother had a surgery done for a gallbladder surgery, and what was impressed upon me was the lack of communication, i.e. the surgical staff and the nursing staff. There was a lot of in and out of room, not explaining what was going on, and her feeling frustrated. So from that sense, I often explain to the nursing staff and myself, I take it upon myself to actually make sure the patients understand what's going on, they're comfortable in the in-house, and that the nurses know to call me if the patient has any questions, just so that they understand that they're being taken care of and not forgotten. I think there is a sense of humility, because when you step into a patient's role and they're in the hospital, there's a sense of they lose the ability, they lose their independence, essentially. They can't go to the bathroom without assistance. They can't go get a sandwich if they want it. They can't get a soda. They're in pain and they're scared. So I think when I first started residency to now, I think that's the biggest thing I've noticed, is you understand that, and you understand your ability to put yourselves in their shoes, and I think it helps them, and it helps me be a better physician. But that's the biggest thing I think I've noticed.